Thank you very much for inviting me to this very important roundtable. And good afternoon and kalispera. I'll try to talk about some aspects regarding geriatric care in Romania. A mandatory condition to live longer is to become older. It's not possible any other way. And on the left side of the image, you can see a very old lady. She lived up to 122 years. She was actually Jean Calmet from France. And now she stopped smoking when she was 120 because she couldn't see the cigarettes anymore, the light up her cigarettes. And he used to ride the bicycle up to 101 years. So I have a lot of prejudices regarding old age. In Romania, the share of older person in our country is lower than the European average, that is 19.1%. But the life expectancy is still lower. This is the life expectancy graph in our country, increased from 2007, this is average life expectancy, from 70 years up to almost 75 years in 2011. 2011, we have the national census, and these are exact figures. And this year estimation is almost 76 years. But you see here the men life expectancy and this lady's life expectancy. There is an important difference, not only in our country, everywhere in the world. You see it was below 70 and reached 71 in men and almost 78 in women in 2018. There are many reasons for that, including in our country, and you'll see at the end one of the reasons. In 1990, we have 1 in 10 people beyond the age of 65 in our country. But in 2011, we have the national census, it reached 16.1%. We have to take into account a large immigration process in our country that was more than 3.5 million. And the estimation for this year is 18%, so it's increasing very fast. You can see here a graph showing the total population, a decrease from 1990 to 2011, from 23.5 to 20 million. So you see those 3.5 million decrease. And also an increase in the percentage of older person. So there are two trends, decrease of general population and increase of percentage of older people in our country. I think everywhere in the world. You see here some age pyramids in Romania. It's an aging pyramid with decreased young generation and increased older population, same like Japan, but of course a different scale. This is an equilibrium pyramid, and this is a young pyramid with a lot of young children born, but decreased very fast. This is a young pyramid. Not always is very good to be young in this case. You see here the trend in our country. In 2050, the base will become the tip, and the tip will become the base, and there is still a difference, increasing difference between ladies and men in our country. In 1952, there was established our National Institute of Geriatric and Gerontology by Professor Aslan, and only in 1992, after 40 years, we have the first specialist in geriatric medicine, so it took a lot of time. The institute has almost 600 beds and also outpatients to more than 50,000 people. And this is Professor Aslan when she was young, and this is when she was a bit older. And this is the first building where the institute was established. It's a historical building in our country. Some of our departments. This is another department, an aerial view of a department with a 30-hectare park around it. And you see some images here. Hope it will load. Okay, this is an inner side of this, and this is populated with patients here. Another image, some cosmetics and also facial work here, and also some lobby, but you know, this is very busy usually, the lobby, not as previously. And this is again for the picture. And here are inside with the kinetics and a lot of rehabilitation programs here. Also some bath. We have in our institute some magnetic therapy, and also these are some flats. There are some luxurious summer flats in our institute, or even a fireplace you can see here. And these are usual rooms in our institute. This is the memorial for our Professor Aslan. You see here, can be visited in orthopedic department. And there are also some other two more very important centers in our country. One in Iași, and I'll show you on the map where it's on the northern part of the country with our colleague Ioan, This is a very nice town. They have a very strong team there. Also in Cluj, our Professor Valer Donka that has a very strong team as well. This is the aerial view of Cluj. This is our country. It's divided in three historical regions: Transylvania, Wallachia, Dobruja, and Moldavia. Moldavia here is our colleague Alexa here, and our colleague from Cluj is here, and we are here in Bucharest. We have this residency program started in 1992, as I told you, around 25 residents each day. And I'll show you the effect of this residency program, the number of geriatricians in our country. And also we have some rotations in geriatrics, in family practice, in rehabilitation medicine. This is the total number of inpatient beds in our country. From 2014 increased, not very much. There have been 952. In 2017, reached almost 1,000 beds. So the increment was not very fast. But there are quite a lot of beds. Unfortunately, most of them are in Bucharest. In our institute, as I told you, there are 600 beds, and there are other two facilities with more than 120, so almost 700 beds are in Bucharest. You here see this administrative map of our country, and these are the inpatient beds in those three provinces. This is in Wallachia, in the southern part of the country. You see the increment is not very fast, and in Moldavia almost constant over the last 4 or 5 years. An important increase was in Transylvania. Also in Transylvania, the percentage of older people is higher as compared to other parts of the country. But we excluded here our institute and the Bucharest because they have a lot, as I told you. Here is a map where you can see the patchy distribution of geriatric medicine in beds and services actually in our country. You see only a few from our districts have this distribution. It's very important to develop a national network, especially outpatient network. You see the number of geriatricians increased from 163 in 2014 up to 215 in 2017. Not very fast because, as I told you, we have 25 residents each year. Here are the outpatient clinics, very few as compared to beds. You see in 2014 only 30 and 17, 67. This is a very difficult situation because we need much more outpatient clinics in our country. As I told you, there is a difference between life expectancy between ladies and men. This happens not only in Romania, everywhere in the world. Women live much longer than men. And now we can see why men live less than women. Thank you very much. I just want to add for the last two questions that, well, they're a bit optimistic because before developing an assessment, you have to develop a network of geriatric clinics. And after that, you can talk about pre-operative assessment made by a geriatric team and also this assessment functionality. This is done usually only in geriatric clinics. Thank you very much.